Schizophrenia is a medical disease that affects the brain and inhibits people from living normal day-to-day lives. Schizophrenia is defined by the National Institute of Mental Health as a chronic, severe, and disabling brain disorder that has affected people throughout history. It is a combination of separate illnesses and affects roughly 1% of the world population. The cause is unknown, but physicians are led to believe it is hereditary, and scientists link problems with the neurotransmitters in the brain. There are multiple forms of schizophrenia. You have paranoid, which is frequent auditory hallucinations and one or more delusions. Delusions are things that are not there, but you think are there. There is disorganized schizophrenia, which is lessened speech and behavior and flat or inappropriate affect. You have catatonic schizophrenia, which is extreme motor immobility and purposeless and excessive motor activity or repetitive behavior such as tics in your eye or OCD, for instance, where you constantly repeat, day-to-day activities over and over again until you think it's right. And then you also have residual schizophrenia, which means that you've had one or more types of schizophrenia happen in the past, but as of right now, the side effects are negative or you have very mild positive symptoms. You have three types of signs and symptoms for schizophrenia. You have positive, which are sensations, beliefs, and behaviors that wouldn't normally occur in day-to-day life. These are the most noticeable signs. Distribution of thought process, like your mind's playing tricks with you. You think you're seeing things that are not there. You think you're going to hear things. You have delusions, which are beliefs that are not true. You have like paranoid delusions, like people are trying to harm you when they're actually trying to help you. You also have delusions where you think that things out in your environment are affected towards you. Like, say, for instance, you see a sign that is saying people need help for mental illness, and you might not think you have a problem and you think it's related towards you, or maybe even other illnesses that you think are related towards you, but you don't have the illnesses. You have somatic delusions, which are erroneous beliefs of yourself, like you're a hypochondriac. You think you're sick all the time. You think that because you stubbed your toe's going to fall off, it's going to get infected, things like that. And you also have delusions of grandeur, like this is you thinking you have special powers or abilities. For instance, you think you're a rock star when you don't know how to play an instrument or you don't know how to sing. And you also have hallucinations where you sense something isn't there, and there are hallucinations for each sense that you have. You can hear things that aren't there, smell things that aren't there, taste different things that aren't there, or even see things that aren't there. And then sometimes your feelings are affected by this, where you are very emotionally unstable. The second kind of symptom is negative symptoms, and this is a lack of abilities to enjoy things like a normal day-to-day life as another person would. You have low energy, blank expressions, little motivation, and you don't really have the ability to make or keep friends or even care if you have any friends. And then the third is cognitive. This is difficulty with concentration and memory. You have slow thinking processes, difficulty expressing your feelings or your expressions towards somebody, and even possibly can't retain your memory of what just happened yesterday. For example, you don't know what you had for breakfast yesterday morning. Diagnosis for schizophrenia is very difficult to pinpoint because there are many tests and exams that a physician has to do to rule out any other psychotic illnesses, psychiatric illnesses, or even mental disease. The physician starts with a mental wellness exam, which takes into account the appearance of the person, their mood, their speech, their affect, even their reliability. And according to the American Psychiatric Association, for a person to be clinically diagnosed with schizophrenia, they must have experienced at least 2 of the following: delusions, hallucinations, disorganized speech, catatonic behaviors, or negative symptoms. After a physician gets done with the mental wellness exam, he rules out the types of schizophrenia that a person might have. For example, paranoid or catatonic or whatever. As far as treatment goes, it varies from person to person and the type and degree of schizophrenia that there is. There are antipsychotic drugs such as clozapine, which is taken by pill, or loxapine, which is inhaled, kind of like an asthma inhaler. You also have psychosocial interventions, which help you talk to other people. You have cognitive remediation, which are like memory skills and such like that. Vocational rehabilitation, which helps people like find jobs out in the real world. And you also have family interventions, which helps you cope with your family and live your day-to-day life as normal as possible. So we learned today that schizophrenia affects roughly 1% of the world population, and it's not something to be taken lightly. If you or your family members feel like you have some of these symptoms or feel like you're just not feeling right, please see your physician and don't try to diagnose yourself. Thank you for enjoying my speech, hopefully, and I'll see you later.